SGRX is a healthcare organization that provides pharmacy benefit management and third-party administration services to private and public entities. It was started by Dr. Harvey Day and Lindsay Roth, servicing the private sector. And over the past 20 years, we've evolved into an organization that's servicing both the private sector, public sector, and most recently, an individual offering also. Our DNA focuses on people. Myself and my partner took over the organization about 6+ years ago, and we made a commitment to ensure that we put people first. And people includes our employees, our partners, our customers, and their beneficiaries. And that could be employees or members, anyone who's covered, because again, we cover both private and public sector. That model has really helped with our success. We keep the team and the end user in mind across every decision that we make.
As Chief Pharmacy Officer, I'm responsible for oversight of clinical services, account services, member services, and human resources. In 2017, I was blessed with the opportunity to become one of the owners of the organization. Over the last 6 years, Ime and I have grown the organization from 6 employees and we're up to 35.
We are headquartered in Michigan. We also have a satellite office in Tennessee. We have customers all over the country. Specifically, we have customers in about 14 different states, and that actually also includes the U.S. Virgin Islands, Hawaii, and so on.
The pandemic brought some new challenges to everyone. We saw a big spike in issues surrounding opioid usage and mental health. Here at SGRX, we've got medication therapy management programming that we have tailored to kind of address those newly emerging issues. We've got a full staff of clinicians, including doctors of pharmacy and nurses, that work with our clients and their members to address those types of issues.
One of the differentiators, again, for us as a smaller entity or boutique entity is that we own our network. We have a network of over 60,000 pharmacies nationwide. That includes all the major players, CVS, Walmart, Walgreens, the grocery chains, and independents all over the country. We have access to competitive pricing because there's no middleman between SGRX and the pharmacy network. Most boutique organizations have a middleman that is handling all those negotiations and contract, and we've been fortunate to build an infrastructure that includes direct contracts with all of the pharmacies across the country and the U.S. territories.
PBM stands for Pharmacy Benefit Management, and that covers a very wide array of services that are offered. In a nutshell, though, we function as the intermediary between the pharmacy network and the payer of the claims. So the payer of the claims could be anything from an employer group to a health plan to a government entity. And then we make all of the magic happen in between those two. So when an individual takes their prescription card to the pharmacy and hands it to the pharmacist, we're the ones behind the scenes making sure that the claims pay, that the formulary adjudicates as appropriate, and that the network is set up as the client has instructed.
We kind of look at our services twofold: the traditional pharmacy benefit management services and also our third-party solutions. Relative to the pharmacy benefit management space, some of our core services are the network management services that we provide, cost management, medication therapy management services. So we have a call center that handles all of our calls. There's no middleman that handles all of the services between us and our customers. And then on the third-party side, we have 340 administration services, which again is directed towards our government program sectors. We currently work with about 12 different states across the country providing third-party services that help their beneficiaries. And then we have insurance benefit management services, again, targeted towards our government sector. And then most recently, we launched our SGRX Saves program, which is a discount card program that's targeting the underinsured and uninsured. Our private sector customers expressed the need to be able to help the employees that are still going out to get medications and not covered by the program. So we provided a solution that helps them be able to get a discounted rate at the pharmacy. for those medications that they have to pay cash for. And then you have the uninsured population that has nothing, no insurance, and they're paying cash, and we're providing another solution, but that targets specifically individuals.
We can offer SGRX Saves all throughout the United States. Anyone can participate in the SGRX Saves program by going to sgrxsaves.com. The strategy that we employ is low net cost. When we have a client that comes to us asking for assistance in managing their drug spend, we put measures in place including formulary management, prior authorizations, and other utilization management tools so that our incentives are aligned with theirs. In other words, we are not making money off of their back by driving up their utilization. We assist them to make sure that the drugs that are filled for their enrollees are at the right time for the right person, and that they stay on the medications to reduce their overall healthcare costs. We take pride in the fact that our member services department is staffed with certified licensed pharmacy technicians. The reason for that is we receive phone calls from physician offices and pharmacies, and we want to make sure that the caller is speaking with someone who understands their needs and knows drug nomenclature that they're using. That translates into a much smoother experience and a higher level of clinical service.
The people aspect of our DNA is what has helped us grow, and we make sure the end user is taken care of regardless of what the situation is at the end of the day.